Wisconsin have seen a 35% increase in diabetic eye screenings.
Yeah, it's very interesting. Patients at Mile Bluff Medical Center in Mauston walk in and have a retinal photograph taken in a matter of minutes. And those photos are then sent to doctors at UW Health in Madison, where eye specialists review them. Dr. Yao Lin is an assistant professor of ophthalmology at the UW School of Medicine. And she's back. You were here 3 years ago when this program was just starting.
Thanks so much for having me.
Welcome back. So tell us a little bit about what teleophthalmology is.
Sure. So teleophthalmology allows patients to have their eyes checked by a doctor who may be even hundreds of miles away using cameras, smartphones, and other new technologies. These technologies allow patients to have access to high-quality eye care in their communities without having to travel long distances.
And how does that work? I mean, just by looking at a photograph, you can see disease?
Yep. So the eye photographs, they take less than 2 minutes to take. They often do not require eye dilating drops, and we can just look at the photo and be able to tell if a patient has diabetic eye disease or not.
What is diabetic eye disease?
So diabetes can cause damage to the eyes and vision loss, and diabetic eye disease is actually the #1 cause of blindness among working age adults here in the United States. And that's unfortunate because we know from research done, led by researchers here at the University of Wisconsin, that 90% of that blindness can be prevented through early detection and treatment.
And what is the treatment?
So there are a wide variety of treatments available. They include a wide variety of lasers, medications, and the most important thing is that people with diabetes get their eyes checked at least once a year to make sure that they have their disease treated if it's present.
Now, why did you decide to use the Mauston medical group, the area in Mauston?
Well, we've had a wonderful relationship with the folks in Mauston, and Juneau County, as you may know, is a rural community in Wisconsin. At the time that we started this program, they were ranked near the bottom of all Wisconsin counties based on national health measures. And so this was a significant area of need, and we thought this would be a wonderful group to partner with.
So it saves them a 75-mile one-way trip to Madison.
Right.
It's a huge difference, absolutely.
A 35% increase in screenings. That's amazing.
Yeah, so in our program, since we started, over 600 patients have received vision-saving eye care using teleophthalmology. And we've identified people with diabetic eye disease and other eye conditions who have actually had vision loss prevented and restored their vision as well.
I was going to ask, what other diseases can you detect with this method?
So sometimes we actually have been able to find cataracts. We've been able to find patients with glaucoma and macular degeneration. The program is really aimed at patients with diabetes for diabetic eye disease, but sometimes we find other things.
Well, this has been such a success. Do you think this will become more common now in rural healthcare?
Yeah, absolutely. Because of our success, we are currently partnering with a large number of other Wisconsin health systems to further make this program available all across our state.
And if you detect there's a problem, like say with diabetic eye disease, does the patient then have to come to Madison?
So we've actually partnered with local eye doctors so that patients who are identified to have abnormal findings can actually see somebody more quickly in their own community.
Well, that's great.
So how long does the whole process take when you walk in to get your retinal photograph?
Well, we tell people it depends a little bit on how busy the clinic is, so be patient with us, but usually most patients are in and out within 10 minutes.
Wow. Well, congratulations on the success and continued success.
Thank you so much.
Great to see you.
Thank you.
Thank you, doctor. Well, the demand